Erie mother concerned about high levels of cancer-causing chemicals found in her 6-year-old son's blood. Got a lot of you talking. Many of you thanked Denver 7 for our report and brought up your own issues living near drilling sites. Now, while the oil and gas industry tried to discredit that report and the woman we interviewed. So tonight, Denver 7's Jennifer Kopalewski is going 360 to show you all sides of this very heated debate over the health impacts of oil and gas.
Almost no one can argue that a 6-year-old boy should be sick with toxic levels of cancer-causing chemicals. What almost no one can agree on, however, is how the benzene got there in the first place. So let's go 360. When we first told you Elizabeth Owaskowicz's story, the feedback came pouring in, offering multiple perspectives.
How does a 6-year-old get to be in the 85th percentile for this? How?
But I was unprepared. She presented the findings of her son's blood test to state regulators this week. It shows high levels of benzene and ethylbenzene, both cancer-causing chemicals, coursing through his body. Owaskowicz worries the 100-plus fracking sites near her home are to blame.
These are high levels. If it's not from the fracking, then where?
A lot of you asked for more context.
It's not a rocket science. If you're releasing toxic chemical compounds into the air, people are probably, and livestock and animals are probably getting exposed to it. Especially.
Dr. John Hughes reached out to us to share his perspective, running these VOC tests on dozens of patients. He says what's most concerning is high levels of ethylbenzene, because unlike benzene, he says this carcinogen rarely comes from other sources.
There's no ethylbenzene in your gasoline, for example.
His view is chronic exposure can lead to leukemia and birth defects.
There's really no debate there. It's just solid science.
The other side took serious issue with this Erie mom's public comments, accusing us of a setup. Writing this article, what Denver 7 didn't tell you last night. Well, what we can tell you is we had no idea Owaskowicz would be at this meeting, and she had no idea we'd be there. Other views they bring up point to studies conducted by the state health department, which looked at health concerns in Erie last November. They found measured levels of all VOCs were well below federal or state health guideline values, suggesting a low risk of harmful health effects. But the flip side isn't totally buying it.
In my opinion, the state is in bed. I mean, and we all know this, the state is in bed with the industry in quite a real way.
Dr. Hughes points to Colorado School of Public Health and CSU studies he says have found links to wells and increased cancer risks. So what's next? No side can agree about what the health impacts of fracking really are. But for this Erie mom, this VOC test is indisputable. And she just wants to know what's causing toxic levels in her son's blood.
I'm a scientist who wants to be thoughtful about this, look at it, and I'm a mom who's trying really hard not to panic over the blood level results I've just found for my son.
And Jennifer is in the studio tonight. Jen, that industry group really tried to discredit that woman and also you.
They did, and we really want to make clear that this is not a red or blue issue, and we are not taking sides. This is a mom concerned about her kid's health, and that's what we reported on. Oil and gas is an important issue facing our community right now, and we want to help continue this important dialogue, Shannon, and looking at all of the perspectives on this issue.
All right, more reporting to come. Thank you for the reporting you've already done. And we want to hear from you. We know you have opinions on oil and gas. Give them to us. Email us 360@thedenverchannel.com, or if you'd rather, send us a message on Facebook or Twitter.